Question 1. A 67-year-old patient with a history of diabetes mellitus presents to the emergency department with generalized weakness and mild confusion. Vital signs reveal a temperature of 38.2 degrees Celsius 100.8 degrees Fahrenheit, heart rate of 104 beats/min, respiratory rate of 22 breaths/min, and blood pressure of 118/72 mmHg. The patient's oxygen saturation is 96% on room air. Laboratory results are pending. Which assessment finding is the earliest indicator of sepsis progression requiring immediate attention? A. Mild hypotension. B. Altered mental status. C. Elevated temperature. D. Tachycardia. Answer. B. Altered mental status. Rationale. Altered mental status is often one of the earliest and most sensitive indicators of sepsis, especially in older adults. It reflects early cerebral hypoperfusion before overt hypotension develops. Tachycardia and fever are common but less specific. Hypotension is a late sign, indicating progression toward septic shock. Question 2. A 54-year-old postoperative patient develops a temperature of 37.9 degrees Celsius 100.2 degrees Fahrenheit, heart rate of 110 beats/min, respiratory rate of 24 breaths/min, and reports feeling slightly anxious. Blood pressure is stable. Which clinical finding should the nurse interpret as the most concerning early sign of sepsis? A. Low-grade fever. B. Tachycardia. C. Increased respiratory rate. D. New-onset anxiety. Answer. C. Increased respiratory rate. Rationale. An increased respiratory rate is often the earliest physiologic response in sepsis, reflecting metabolic acidosis and compensatory hyperventilation. It is a key component of early warning scores, e.g., QSOFA. Anxiety and tachycardia are important but less specific than tachypnea. Question 3. A 72-year-old patient from a nursing home presents with suspected infection. The nurse notes the patient is afebrile but confused, with a respiratory rate of 26 breaths/min and heart rate of 98 beats/min. Blood pressure is 122/80 mmHg. Which interpretation is most accurate? A. Sepsis is unlikely without fever. B. Normal blood pressure rules out sepsis. C. The patient is exhibiting early signs of sepsis. D. Tachycardia must be present to diagnose sepsis. Answer. C. The patient is exhibiting early signs of sepsis. Rationale. Sepsis can occur without fever, especially in older adults. Early signs include tachypnea and altered mental status. Normal blood pressure does not exclude sepsis, as hypotension is a late finding. Question 4. A 45-year-old patient with pneumonia begins to show subtle changes. Which finding indicates early systemic inflammatory response associated with sepsis? A. Decreased urine output to 10 milliliters per hour. B. Warm, flushed skin. C. Cold, clammy extremities. D. Systolic blood pressure of 85 millimeters of mercury. Answer. B. Warm, flushed skin. Rationale. Early sepsis, hyperdynamic phase, is characterized by vasodilation, leading to warm, flushed skin. Cold, clammy skin and hypotension occur later during septic shock. Oliguria is also a later sign of organ dysfunction. Question 5. A nurse is assessing a patient with suspected sepsis. Which laboratory value would support early detection of sepsis before organ failure occurs? A. Serum lactate of 1.2 millimoles per liter. B. White blood cell count of 14,500/mm superscript 3. C. Creatinine of 2.5 milligrams per deciliter. D. Platelet count of 80,000/mm superscript 3. Answer. B. White blood cell count of 14,500/mm superscript 3. Rationale. An elevated WBC count indicates an early inflammatory response to infection. Elevated creatinine and thrombocytopenia suggest organ dysfunction, which occurs later. Lactate elevation, not present here, is a key early marker of hypoperfusion. Question 6. A 60-year-old patient presents with suspected urinary tract infection. Which combination of findings should the nurse recognize as meeting early sepsis criteria, sirs? A. HR 88 BPM, RR 18, temp 36.5 degrees Celsius. B. HR 102 BPM, RR 24, temp 38.5 degrees Celsius. C. BP 90/60 mmHg, HR 95 BPM. D. SpO2 92%, RR 20. Answer. B. HR 102 BPM, RR 24, temp 38.5 degrees Celsius. Rationale. SIRS criteria include tachycardia, greater than 90, tachypnea, greater than 20, and fever, greater than 38 degrees Celsius. This combination strongly suggests early sepsis when infection is suspected. Hypotension is not required for early diagnosis. Question 7. A patient with a suspected abdominal infection becomes increasingly restless and reports feeling uneasy. Vital signs show HR 108 BPM, RR 22 breaths/min, BP 120/76 mmHg. What is the nurse's priority interpretation? A. Anxiety is unrelated to infection. B. This is a normal stress response. C. Restlessness may indicate early hypoxia or sepsis. D. Blood pressure stability rules out deterioration. Answer. C. Restlessness may indicate early hypoxia or sepsis. Rationale. Restlessness and anxiety are early neurologic signs of hypoxia and sepsis, often preceding measurable changes like hypotension. These subtle signs must be taken seriously. Question 8. A nurse is monitoring a patient with suspected sepsis. Which trend is most concerning for early tissue hypoperfusion? A. Increasing urine output. B. Decreasing serum lactate. C. Rising serum lactate from 1.5 to 3.0 millimoles per liter. D. Stable vital signs. Answer. C. Rising serum lactate from 1.5 to 3.0 millimoles per liter. Rationale. An increasing lactate level indicates worsening tissue hypoxia and hypoperfusion, even before hypotension develops. This is a critical early marker of sepsis severity. Question 9. A 39-year-old patient presents with fever and suspected infection. Which assessment finding most strongly suggests early sepsis-related respiratory compensation? A. Oxygen saturation of 98%. B. Respiratory rate of 28 breaths/min. C. Clear lung sounds. D. Absence of dyspnea. Answer. B. Respiratory rate of 28 breaths/min. Rationale. Tachypnea is an early compensatory response to metabolic acidosis in sepsis. It often occurs before oxygen saturation drops or dyspnea becomes apparent. Question 10. A patient with suspected sepsis has the following findings: HR 105 BPM, RR 23 breaths/min, BP 110/70 mmHg, and new confusion. What is the nurse's priority action? A. Wait for laboratory confirmation. B. Document findings and reassess in 1 hour. C. Initiate sepsis protocol immediately. D. Administer antipyretics only. Answer. C. Initiate sepsis protocol immediately. Rationale. Early recognition and rapid intervention, sepsis bundle, are critical. Waiting for labs delays treatment and increases mortality. The patient already meets criteria for suspected sepsis with organ involvement, confusion. Question 11. A 70-year-old patient with a history of chronic kidney disease presents with suspected infection. The nurse notes a temperature of 37.2 degrees Celsius 99 degrees Fahrenheit, heart rate of 112 beats/min, respiratory rate of 26 breaths/min, and new confusion. Blood pressure is 124/78 mmHg. Which interpretation is most accurate? A. Absence of fever excludes sepsis. B. Findings indicate early sepsis despite normal temperature. C. Tachycardia is due to chronic illness. D. Normal blood pressure rules out sepsis. Answer. B. Findings indicate early sepsis despite normal temperature. Rationale. Sepsis may present without fever, especially in older adults or immunocompromised patients. Tachypnea, tachycardia, and altered mental status strongly suggest early sepsis even with a normal temperature. Question 12. A postoperative patient begins to exhibit subtle changes. Which finding should the nurse identify as the earliest indicator of worsening sepsis? A. Blood pressure of 88/54 mm of mercury. B. Urine output of 15 milliliters per hour. C. Respiratory rate increase from 18 to 24 breaths/min. D. Cool, mottled extremities. Answer. C. Respiratory rate increase from 18 to 24 breaths/min. Rationale. A rising respiratory rate is often the first measurable change indicating sepsis progression. Hypotension, oliguria, and mottling are late findings associated with shock. Question 13. A 50-year-old patient with suspected sepsis reports chills and appears flushed. Vital signs: temp 38.7 degrees Celsius, HR 108 BPM, RR 22, BP 118/74 mmHg. Which pathophysiologic process explains the patient's flushed appearance? A. Peripheral vasoconstriction. B. Increased cardiac output. C. Systemic vasodilation. D. Decreased oxygen delivery. Answer. C. Systemic vasodilation. Rationale. Early sepsis causes systemic vasodilation, leading to warm, flushed skin. This is part of the hyperdynamic phase before vasoconstriction and shock occur. Question 14. A nurse is assessing a patient with suspected sepsis. Which finding best indicates early neurologic involvement? A. Glasgow Coma Scale score of 6. B. Sudden agitation and confusion. C. Unresponsive pupils. D. Decorticate posturing. Answer. B. Sudden agitation and confusion. Rationale. Early neurologic changes in sepsis include agitation, confusion, and restlessness. Severe findings like coma or posturing occur much later. Question 15. A patient with a suspected wound infection develops a respiratory rate of 30 breaths/min. Arterial blood gas reveals metabolic acidosis. What is the primary cause of this respiratory change? A. Lung infection. B. Pain response. C. Compensation for metabolic acidosis. D. Anxiety. Answer. C. Compensation for metabolic acidosis. Rationale. Sepsis leads to lactic acidosis, and the body compensates with tachypnea to blow off CO2, helping to normalize pH. Question 16. A nurse notes a patient with suspected sepsis has warm skin, bounding pulses, and a heart rate of 115 BPM. Blood pressure is 122/70 mmHg. What stage of sepsis is most consistent with these findings? A. Septic shock. B. Late sepsis. C. Early, hyperdynamic, sepsis. D. Recovery phase. Answer. C. Early, hyperdynamic, sepsis. Rationale. Early sepsis is characterized by warm skin, bounding pulses, and tachycardia due to vasodilation and increased cardiac output. Question 17. A patient with suspected sepsis has a serum lactate level of 2.8 millimoles per liter, vital signs are stable. What is the nurse's best interpretation? A. This is a normal finding. B. Indicates early tissue hypoperfusion. C. Suggests respiratory alkalosis. D. Not clinically significant without hypotension. Answer. B. Indicates early tissue hypoperfusion. Rationale. Elevated lactate, greater than 2 millimoles per liter, indicates early tissue hypoxia and hypoperfusion, even if blood pressure remains normal. Question 18. A nurse is monitoring a patient with suspected sepsis. Which subtle change should prompt immediate reassessment? A. Slight increase in appetite. B. New onset of mild confusion. C. Stable oxygen saturation. D. Normal blood pressure. Answer. B. New onset of mild confusion. Rationale. Even mild confusion can signal early cerebral hypoperfusion and sepsis. It is a critical early warning sign. Question 19. A patient with infection develops tachycardia and tachypnea. Which additional finding would confirm systemic inflammatory response syndrome, SIRS? A. Blood glucose of 90 mg per deciliter. B. White blood cell count of 3,500/mm superscript 3. C. Oxygen saturation of 97%. D. Urine output of 40 milliliters per hour. Answer. B. White blood cell count of 3,500/mm superscript 3. Rationale. SIRS includes WBC less than 4,000 or 12,000/mm superscript 3, along with tachycardia and tachypnea. Leukopenia is also a sign of severe infection. Question 20. A nurse suspects early sepsis in a patient with pneumonia. Which action is most critical to perform immediately upon recognition of early signs? A. Administer 4 antibiotics after culture collection. B. Wait for blood culture results. C. Provide oral fluids only. D. Delay intervention until hypotension occurs. Answer. A. Administer 4 antibiotics after culture collection. Rationale. Early administration of broad-spectrum antibiotics after obtaining cultures is critical in sepsis management. Delays significantly increase mortality. Question 21. A 63-year-old patient presents with suspected infection. The nurse observes a respiratory rate of 25 breaths/min, heart rate of 102 beats/min, and the patient appears slightly disoriented. Blood pressure is 126/80 mmHg. Which interpretation is most appropriate? A. The patient is stable because blood pressure is normal. B. These findings suggest early sepsis despite stable hemodynamics. C. Disorientation is unrelated to infection. D. Tachypnea is likely due to anxiety. Answer. B. These findings suggest early sepsis despite stable hemodynamics. Rationale. Early sepsis often presents with tachypnea, tachycardia, and altered mental status before hypotension develops. Normal blood pressure does not exclude sepsis. Question 22. A patient with suspected sepsis has a urine output trending from 40 milliliters per hour to 22 milliliters per hour over 3 hours. Vital signs remain stable. What does this indicate? A. Normal variation in renal function. B. Early renal hypoperfusion. C. Adequate hydration status. D. Resolution of infection. Answer. B. Early renal hypoperfusion. Rationale. A decreasing urine output, less than 30 milliliters per hour, is an early sign of organ hypoperfusion, even before hypotension occurs. Question 23. A nurse notes that a patient with infection has developed cool extremities after previously having warm, flushed skin. What does this change most likely indicate? A. Improvement in condition. B. Transition to late sepsis or septic shock. C. Normal thermoregulation. D. Dehydration only. Answer. B. Transition to late sepsis or septic shock. Rationale. Sepsis progresses from warm, vasodilation, to cold, vasoconstriction, phase, indicating worsening perfusion and possible shock. Question 24. A patient with suspected sepsis becomes increasingly tachypneic with a respiratory rate of 32 breaths/min. Oxygen saturation remains 95%. What is the primary concern? A. Impending respiratory failure only. B. Compensation for metabolic acidosis. C. Anxiety-induced hyperventilation. D. Normal finding in infection. Answer. B. Compensation for metabolic acidosis. Rationale. Tachypnea in sepsis is often due to metabolic acidosis, lactic acidosis. Not necessarily hypoxia, explaining normal oxygen saturation. Question 25. A nurse assesses a patient with suspected sepsis and notes bounding pulses and widened pulse pressure. What is the most likely explanation? A. Decreased cardiac output. B. Peripheral vasoconstriction. C. Systemic vasodilation. D. Fluid overload. Answer. C. Systemic vasodilation. Rationale. Early sepsis causes vasodilation, leading to bounding pulses and widened pulse pressure due to increased cardiac output. Question 26. A patient presents with infection and a serum lactate level rising from 2.2 to 4.1 millimoles per liter within 2 hours. Blood pressure remains 118/76 mmHg. What is the nurse's priority interpretation? A. Stable condition due to normal BP. B. Severe tissue hypoperfusion despite normal BP. C. Lab error. D. Respiratory alkalosis. Answer. B. Severe tissue hypoperfusion despite normal BP. Rationale. A rising lactate, greater than 4 millimoles per liter, indicates significant hypoperfusion and worsening sepsis, even in the absence of hypotension. Question 27. A 58-year-old patient with pneumonia develops restlessness and difficulty focusing. Vital signs show HR 110 BPM, RR 24 breaths/min, BP 122/78 mmHg. What should the nurse recognize? A. Early neurologic sign of sepsis. B. Medication side effect. C. Sleep deprivation. D. Anxiety disorder. Answer. A. Early neurologic sign of sepsis. Rationale. Restlessness and decreased concentration are early cerebral signs of sepsis, often preceding severe neurological impairment. Question 28. A nurse is evaluating a patient with suspected sepsis. Which finding indicates progression toward organ dysfunction? A. Temperature of 38.1 degrees Celsius. B. Heart rate of 105 BPM. C. Platelet count of 90,000/mm superscript 3. D. Respiratory rate of 22 breaths/min. Answer. C. Platelet count of 90,000/mm superscript 3. Rationale. Thrombocytopenia, 100,000/mm superscript 3, suggests coagulopathy and organ dysfunction, indicating worsening sepsis. Question 29. A patient with suspected sepsis has the following ABG, pH 7. 30, PaCO2 30 mm of mercury, HCO3 18 milliequivalent/L. What is the interpretation? A. Respiratory alkalosis. B. Metabolic acidosis with respiratory compensation. C. Metabolic alkalosis. D. Normal ABG. Answer. B. Metabolic acidosis with respiratory compensation. Rationale. Low pH and low bicarbonate indicate metabolic acidosis, while low CO2 reflects compensatory hyperventilation, common in sepsis. Question 30. A nurse identifies early sepsis in a patient. Which intervention is most critical within the first hour? golden hour. A. Delay antibiotics until culture results return. B. Initiate 4 fluids and broad-spectrum antibiotics. C. Provide oral hydration only. D. Monitor without intervention. Answer. B. Initiate 4 fluids and broad-spectrum antibiotics. Rationale. The sepsis bundle emphasizes rapid fluid resuscitation and early antibiotic administration within the first hour to improve survival. Question 31. A 68-year-old patient with a history of hypertension presents with a urinary tract infection. The nurse notes a respiratory rate increasing from 20 to 27 breaths/min over 2 hours, heart rate of 108 beats/min, and the patient appears slightly confused. Blood pressure remains 130/84 mmHg. What is the most appropriate interpretation? A. Stable condition due to normal blood pressure. B. Early sepsis with compensatory respiratory changes. C. Anxiety-related tachypnea. D. Expected response to infection. Answer. B. Early sepsis with compensatory respiratory changes. Rationale. A rising respiratory rate with confusion indicates early sepsis and metabolic compensation, even when blood pressure is still normal. Question 32. A nurse is assessing a patient with suspected sepsis. Which change from baseline is most concerning? A. Temperature increase from 36.8 degrees Celsius to 37.5 degrees Celsius. B. Heart rate increase from 78 to 92 bpm. C. Respiratory rate increase from 16 to 22 breaths/min. D. Blood pressure decrease from 130/80 to 124/78 mmHg. Answer. C. Respiratory rate increase from 16 to 22 breaths/min. Rationale. Even a small increase in respiratory rate can be an early and sensitive sign of sepsis progression. Question 33. A patient with infection develops new-onset confusion and restlessness. Vital signs are HR 104 bpm, RR 24 breaths/min, BP 118/76 mmHg. Which action should the nurse take first? A. Document and reassess later. B. Initiate sepsis screening protocol. C. Administer sedatives. D. Wait for fever to develop. Answer. B. Initiate sepsis screening protocol. Rationale. Early signs such as confusion and tachypnea require immediate sepsis screening to prevent progression. Question 34. A patient with suspected sepsis has warm skin and bounding pulses. Which additional finding would indicate worsening condition toward shock? A. Increased urine output. B. Narrowing pulse pressure. C. Cool, clammy extremities. D. Decreased heart rate. Answer. C. Cool, clammy extremities. Rationale. Transition from warm to cool, clammy skin indicates progression to late sepsis/septic shock. Question 35. A nurse observes that a patient with infection is increasingly tachypneic despite normal oxygen saturation. What is the underlying cause? A. Pulmonary embolism. B. Compensation for lactic acidosis. C. Anxiety. D. Bronchospasm. Answer. B. Compensation for lactic acidosis. Rationale. Tachypnea occurs as compensation for metabolic, lactic, acidosis, not necessarily due to hypoxia. Question 36. A patient with suspected sepsis has a lactate level of 3.5 millimoles per liter, vital signs are stable. What is the nurse's priority interpretation? A. No concern due to stable vitals. B. Early hypoperfusion requiring urgent intervention. C. Normal finding in infection. D. Indicates respiratory alkalosis. Answer. B. Early hypoperfusion requiring urgent intervention. Rationale. Elevated lactate indicates tissue hypoxia, even without hypotension, and requires immediate action. Question 37. A nurse notes a patient with suspected sepsis has become increasingly lethargic. What does this most likely indicate? A. Improvement in condition. B. Sleep deprivation. C. Worsening cerebral perfusion. D. Medication side effect. Answer. C. Worsening cerebral perfusion. Rationale. Lethargy is a sign of decreased cerebral perfusion, indicating worsening sepsis. Question 38. A patient with infection has HR 112 BPM, RR 26 breath/min, WBC 13,000/mm superscript 3, and appears anxious. What is the most accurate interpretation? A. Normal stress response. B. Meets criteria for systemic inflammatory response. C. Anxiety disorder. D. Requires no intervention. Answer. B. Meets criteria for systemic inflammatory response. Rationale. The patient meets SIRS criteria, tachycardia, tachypnea, elevated WBC, suggesting early sepsis. Question 39. A nurse is monitoring a patient with suspected sepsis. Which finding indicates early cardiovascular compensation? A. Bradycardia. B. Hypotension. C. Tachycardia. D. Weak pulses. Answer. C. Tachycardia. Rationale. Tachycardia is an early compensatory mechanism to maintain cardiac output and perfusion. Question 40. A patient with suspected sepsis develops a drop in urine output to 18 milliliters per hour. What does this indicate? A. Adequate renal function. B. Early kidney injury due to hypoperfusion. C. Normal variation. D. Overhydration. Answer. B. Early kidney injury due to hypoperfusion. Rationale. Low urine output, less than 30 milliliters per hour, is an early sign of renal hypoperfusion and organ dysfunction. Question 41. A 66-year-old patient with a history of COPD presents with suspected infection. The nurse notes a respiratory rate of 28 breaths/min, heart rate of 106 beats/min, and new onset confusion. Oxygen saturation is 95% on room air. Blood pressure is 128/82 mmHg. What is the most accurate interpretation? A. Respiratory changes are due to COPD only. B. Normal oxygen saturation excludes sepsis. C. Early sepsis with compensatory tachypnea. D. Confusion is unrelated to infection. Answer. C. Early sepsis with compensatory tachypnea. Rationale. Tachypnea and confusion indicate early sepsis, even with normal oxygen saturation and blood pressure. Question 42. A nurse is assessing a patient with suspected sepsis. Which subtle sign is often overlooked but highly significant in early detection? A. Mild tachycardia. B. Slight increase in temperature. C. Change in mental status. D. Elevated blood pressure. Answer. C. Change in mental status. Rationale. Altered mental status is frequently the earliest and most critical sign, especially in older adults. Question 43. A patient with infection develops a respiratory rate of 30 breaths/min and reports no shortness of breath. What should the nurse recognize? A. Respiratory distress is absent. B. Early metabolic acidosis compensation. C. Anxiety-induced breathing. D. Normal variation. Answer. B. Early metabolic acidosis compensation. Rationale. Tachypnea without dyspnea suggests compensation for metabolic acidosis, common in early sepsis. Question 44. A nurse notes a patient with suspected sepsis has a heart rate increasing from 96 to 118 bpm over 1 hour. Blood pressure remains stable. What does this indicate? A. Improvement. B. Early compensatory response to infection. C. Anxiety. D. Dehydration only. Answer. B. Early compensatory response to infection. Rationale. Rising heart rate is an early sign of compensation to maintain perfusion in sepsis. Question 45. A patient with suspected sepsis has warm skin, bounding pulses, and a widened pulse pressure. What is the underlying mechanism? A. Increased systemic vascular resistance. B. Decreased cardiac output. C. Peripheral vasodilation. D. Hypovolemia. Answer. C. Peripheral vasodilation. Rationale. Early sepsis causes vasodilation, leading to warm skin and bounding pulses. Question 46. A nurse observes a patient transitioning from warm, flushed skin to cool, mottled extremities. What is the priority interpretation? A. Recovery phase. B. Transition to septic shock. C. Normal response. D. Mild dehydration. Answer. B. Transition to septic shock. Rationale. Cool, mottled skin indicates worsening perfusion and progression to shock. Question 47. A patient with infection shows a decrease in urine output from 35 ml per hour to 20 ml per hour, vital signs remain stable. What is the nurse's best interpretation? A. Adequate renal function. B. Early sign of organ hypoperfusion. C. Normal variation. D. Fluid overload. Answer. B. Early sign of organ hypoperfusion. Rationale. Decreasing urine output is an early indicator of renal hypoperfusion, even before hypotension. Question 48. A nurse reviews lab results for a patient with suspected sepsis. Which finding indicates early coagulopathy? A. Platelet count of 95,000/mm superscript 3. B. Hemoglobin of 13G/dl. C. Sodium of 140 milliequivalent/L. D. Glucose of 100 mg per deciliter. Answer. A. Platelet count of 95,000/mm superscript 3. Rationale. Thrombocytopenia suggests early coagulopathy and progression of sepsis. Question 49. A patient with suspected sepsis has the following findings: RR27, HR110, new confusion, lactate 3.2 millimoles per liter, blood pressure is 118/74 mmHg. What is the priority nursing action? A. Wait for hypotension to develop. B. Initiate sepsis bundle immediately. C. Monitor and reassess in 2 hours. D. Administer oral antibiotics. Answer. B. Initiate sepsis bundle immediately. Rationale. The patient shows clear early sepsis with hypoperfusion, elevated lactate. Immediate intervention is critical. Question 50. A nurse is educating a new staff member about early sepsis recognition. Which statement indicates correct understanding? A. Hypotension is the first sign of sepsis. B. Fever must be present to diagnose sepsis. C. Changes in respiratory rate and mental status are early indicators. D. Sepsis can only be diagnosed with lab confirmation. Answer. C. Changes in respiratory rate and mental status are early indicators. Rationale. Early sepsis is best identified by subtle changes such as tachypnea and altered mental status, not late signs like hypotension. Congratulations! You've completed 50 pro-level questions on early sepsis recognition. Remember, in real-life emergency care, tachypnea and subtle mental changes are often the first red flags. Early lactate elevation signals hidden tissue hypoperfusion. Act fast, every hour counts, fluids, antibiotics, and monitoring save lives. Master these early warning signs, and you'll be ready to identify sepsis before it becomes septic shock, giving your patients the best chance for survival. Stay sharp, trust your assessment skills, and always think, early recognition equals early intervention equals lives saved.